that's just one list. Okay? Atherosclerosis. Okay? What do we consider hypertension?
138.
It depends on your age group and exactly which numbers they use, but basically they look at, 140 over like 80 above that as being hypertensive. Just kind of in general. So if somebody is hypertensive, what part of their cardiac output is most affected? Okay, what makes up cardiac output?
The force from the heart
Times the,
the resistance from the veins, or arteries.
okay, yeah. So we have stroke volume, which is heart rate, times the amount that you're squeezing out, okay? That's your cardiac output. And your cardiac output gets very affected by how hard that ventricle has to squeeze to get stuff out, okay? So what's the part that makes it hard to get through?
Your resistance.
That's afterload. Okay, afterload, that's the stuff that comes after the heart. So if I've got high blood pressure, which probably means I've got some vasoconstriction, some atherosclerosis going on, and all this kind of good stuff that's causing my high blood pressure, then it makes it harder for the heart to squeeze to get blood out. The heart has to work harder to get blood pushed through all those big snacks you've been eating. Okay? And that's afterload, part that comes after the heart. Now, when your patient has lower extremity edema, what could that be from? Okay, it could be due to heart failure, okay, because the heart isn't pumping as effectively as it should. But what else can it be due to?
When you're not producing enough water.
Okay, so, yeah, if you're not getting rid of enough water, okay, but that usually goes along with, but what's, arteries are thicker, stronger, okay, and more muscular. Veins are not, but what do all veins have except the pulmonary vein?
Valves?
Yes,
Yeah.
thank you. Tasha's up here.
Couldn't get the word to come out.
Making, valves.
Oh, so
All veins have valves, and that's to prevent the blood from flowing backwards during diastole, right? So, your blood is down around your ankles, and now your heart's at rest, and it's like, oh, here comes all the blood from up there, and now it's gotta get pumped all back up again. No, that's why we have valves, to help prevent that, right? But if you have venous insufficiency, your valves aren't working like they're supposed to, and so you get a backup of blood in whatever area is affected, most likely the legs, and it's going to cause, what did you say? Cause edema. Thank you very much. Okay, you have a patient that has an elevated SED rate. Okay, what does that test tell us? Inflammation, okay? So if you were looking for a disease process that involved inflammation, what letters would you expect to see at the end of it? Itis, right. It would be some kind of itis is an inflammatory process. You have a patient that has peripheral arterial disease. So what's the problem if they have peripheral arterial disease?
They can't do anything?
They can't, yeah, they may have decreased sensation of their feet. So what kind of nursing things would you be telling them?
Who wear
Socks?
Shoes.
Shoes. Yes, to wear shoes at all times, because they may not be able to tell, that they've hurt themselves. Plus, not only that, and if they do, they're gonna have a harder time healing because of the peripheral arterial disease. It's not gonna have good blood flow there. I'm sorry, I didn't mean to run into you. Okay. Yeah, I won't run into you. Yeah. Okay. You got it.
Was there more to that question or just the shoe?
It was mainly, they should be, not walking around barefoot.
Checking temperature of water, sidewalk.
Mm-hmm. Yep. Okay, so you've done a physical assessment on your patient. And they're testing for valvular disease. What kind of physical assessment finding on your patient would suggest that they have valvular disease? Alright, what kind of physical cardiac assessment? Okay,
For running?
Okay,
Or kind of
for valvular disease.
like an arrhythmia or messed up rhythm?
Is it treadmill?
If you are listening to the heart,
No, it's one of the valves that actually aren't sealing correctly right in the heart.
right, and what's it gonna sound like?
Like the third, like a, kind of like.
You're gonna hear a murmur.
a little bit
Just
murmur.
a bit.
Go, Elena. Yes, you're gonna hear a murmur. Okay, if they have valvular disease, you can usually tell that by, you'll hear a murmur, okay? If they have, atherosclerosis or vascular disease in their carotids, what would you hear?
If they have what?
Yeah, a bruit. A vascular disease or atherosclerosis in their carotid arteries, when you listen, you would hear that bruit. B-R-U-I-T. Sound, it looks like bruit, but it's pronounced brewy. Okay. So, in their stroke presentation today, they talked about TEE. And what were they looking at when they did a TEE?
The heart valves.
Okay, they were looking at how well the heart valves are functioning, that's true, but what else can they tell when they do a TEE?
There's a foramen emboli in there.
That's true. They can tell if there's, blood clots in the atria. A lot of times when somebody has atrial fib, you know, we talked about atrial fib, it's where the atria are just doing this number, but the ventricles are still squeezing, okay? And what happens when the atria is doing this, blood's not getting forced out, so there's blood that pools against the atrial walls. And what happens to blood when it pools? It clots, right? And so the risk we have is that all of a sudden the atria is gonna go back into a normal rhythm, and it's gonna get good squeeze, and it's gonna break off part of that clot and send it either to the lungs or the brain or the heart, depending on which side of the heart that clot is, right? So, if they're gonna do like a cardioversion for somebody that's an atrial fib to try to get it back into a normal rhythm, they do a TEE first to check and see if there's any clots there, because if there are, then they have to wait to do the cardioversion until those clots are all gone. They'll put them on heparin and send them home for a couple weeks until those clots have all disintegrated and gone away, and then they'll do the cardioversion to try to get them shocked into a normal rhythm again. But that TEE is looking for clots in the atria. Usually, when they're doing that, it's somebody with atrial fibrillation. Could be atrial flutter too, but atrial fib is most common. Okay, your patient's heart is decompensating. What does that mean? Is it getting better or worse? Worse. Okay, it's decompensating, so that means it's getting worse. So, what would tell us that the heart is not doing as well?
Decreased cardiac output.
Okay, decreased cardiac output. The heart's not pumping out as well.
So, probably.
Okay, so be some decreased oxygenation. So what happens if you have decreased oxygenation?
Fusion.
Okay.
Die. Confusion.
Well, yeah, before you die, okay? We're just decompensating, we're not decompensating.
Just throw it out there. That's always a possibility.
Okay, so heart's not working as well, so we're not getting enough oxygen out to everything we need. And so if you're not getting enough oxygen out to everything we need, then you start getting shorter breath with any exertion. Okay, does that make sense?
Yeah.
Okay, because the other thing that happens when your heart is not pumping as effectively is blood backs up, because it's at where? Where does blood back up from your heart to? Your lungs, right? Okay, so the left ventricle is not pumping as effectively as it should, so blood would back up into your lungs, and so what would that cause?
Crackles?
Crackles. It would cause a moist cough. You would see a decrease in urine output because the kidneys aren't getting perfused. But yeah, sometimes that's one of the first signs you start seeing is the patient will be complaining is they get shorter breath, walking down to the mailbox when they didn't used to. So they get, dyspneic on exertion. Okay, your patient complains of when they try to exercise, they have chest pain, but when they sit down, it goes away. So, what is that called? Okay, first, what is cardiac chest pain called? Angina, okay? And there's different kinds of angina. Stable angina is the one that if they get it with exercise, they sit down and rest, it goes away. Okay, there's a pattern there, okay? Unstable angina, that's what happens when you're having a heart attack. Okay, doesn't matter if you lay down, sit down and rest, pain does not go away. And you are either getting ready to or already in the process of having a heart attack, so that's unstable angina. Principal angina is the one that's due to vasoconstriction. It's not due to atherosclerosis, it's due to vasoconstriction. Okay, your patient has a pericardial effusion. where is your pericardium? It's around your heart, right? Your heart has the epicardium, the outermost layer of the heart, also known as it's part of the pericardial, okay? And then we have the fluid in there, and then we have the pericardial sac itself, okay? So if we have a pericardial effusion, that means we have too much fluid building up in that sac around the heart. So what happens to the heart then? Okay, it can't pump adequately, right? It's kind of getting strangled. And so if it can't pump adequately, patient's gonna be short of breath. Okay, so then what do we do? What do we do for patients that are short of breath? Well, sit them upright. You're gonna elevate the head of the bed, right? They're gonna breathe better because the abdominal contents are gonna be down. That gives room for the diaphragm to lower, so they have more room to breathe. Okay? So you're gonna elevate the head of their bed. Okay, when they're having shortness of breath. Okay, what about if you have pericarditis? What's that? Inflammation of the pericardium. Okay, and so what kind of things can cause an inflammation of the pericardium? Possibly, it would depend on where the infection is. It would have to be of the epicardial layer or out. But more likely, when we have that inflammation of the pericardium, it's because they've had a heart attack. A lot of times we see that post-heart attack. And, post-MI, not quite half, somewhere depending on who you read, anywhere 7 to 41% of people that have a heart attack will have pericarditis afterward. So, depends. Okay, so your patient has atherosclerosis. And you're going to sit down and do a good teaching session with them, what they can do to help deal with or improve their atherosclerosis. What kind of lifestyle changes should you be teaching them?
Exercise, eat better.
Okay, exercise, eat better. They're on medications. Do they take them only when they have symptoms, or should they be taking them all the time? They should be taking it every day at the same time, okay? And, you said, yeah, you would teach about diet. What kind of diet? But even more important than that, for atherosclerosis, low fat, low cholesterol. Okay, because that cholesterol is what builds up the LDL, what builds up and causes atherosclerosis. So, low fat, low cholesterol diet would be, that. What about cigarette smoking?
Yeah.
They have to stop. You can't just say, well, I'll just, cut back from 2 packs a day to 1 pack a day. Not gonna help them. They have to stop. Okay? And we want them to definitely start exercising. Okay, your patient had a carotid endarterectomy. What is that? Carotid ectomy. That means we removed, we opened it up. Yeah, carotid endarterectomy is where they go in and they remove the plaque from inside the carotid artery, that atherosclerosis. Okay, so they've had a carotid endarterectomy and they are now hypotensive. what should you do? What is the first thing that you should do to help them? Okay, well, you can check them for bleeding while you're doing what?
Arousing.
You already did vitals, and you know their blood pressure is they're hypotensive.
Putting them up. Putting them up.
No, sitting up is gonna make their blood pressure go down.
Reverse.
No, you don't have to reverse Trendelenburg, and actually there's a lot of, controversy on using a reverse Trendelenburg that it can actually increase intracranial pressure. I'd have to lay them flat. Yeah, just lay them flat. Okay, that will help their blood pressure right there.
How's that?
Okay, yeah, and you can, and they say, you know, you can lay them flat, and then you can elevate their legs, but you don't wanna tip their head down backwards, okay? So, yeah, you can lay them flat, and if that's not enough, you can elevate their legs. Now granted, all of this is gonna be taking place while you're checking for bleeding, you're calling, you know, somebody's calling on their doctor, or their healthcare provider, et cetera, and so forth. But, you know, you're there at the bedside, you just did their vital signs, and their blood pressure is too low, you lay them flat, cause you're right there. And then you start, you know, doing all this other stuff. Okay, your, patient has a brain natriuretic peptide level to be drawn, a BNP, brain natriuretic peptide. So what does that mean? Brain natriuretic peptide.
A BNP?
A BNP. People often get confused with BMP, which is the basic metabolic panel. But that's not, this is brain natriuretic peptide, a BNP.
See if there's an increase.
Okay, we wanna see if there's an increase, cause, yeah, what would it tell us if it was increased?
Blood pressure?
Heart failure. Okay, BNP, that is a hormone that's released by the heart when it gets stretched because there's a fluid overload there. And so it releases brain natriuretic peptide, which is a natural diuretic, to try to help, you know, get rid of that excess, fluid. So if somebody's BNP, brain natriuretic peptide, is elevated, that's a sign of heart failure. Okay. Excuse me. Your patient that was, diagnosed with pericarditis is put on steroids. Why would they be put on steroids? To help decrease the inflammation. And so what do the patients need to know about taking steroids?
They can't stop them.
Yeah, they can't just stop them. And, they have to take it the same time every day. So basically, they have to take it, that medication as prescribed. They can't, you know, say, oh, I'm getting better, so I don't need to take this anymore, just kind of antibiotics. You have to take it as prescribed, and the prescription will include that taper down period at the end. Okay, your patient is hypotensive and a little bit tachycardic. What's causing this? What kind of physical reaction? If I would say, is it inotropic, chronotropic, or domotropic?
One more time?
Inotropic, domotropic, or chronotropic? Chronotropic, okay, would be a positive or negative chronotropic effect? Positive, because the heart rate's gone up, right? Okay, so that would be a positive chronotropic effect. Bless you. And your patient has type 2 diabetes, and they are now diagnosed with carotid artery disease. So you're gonna talk to them about, controlling their blood sugar. What do you need to emphasize with them?
What do you need to emphasize about?
Mm-hmm.
They need to take their blood sugar before and after each meal.
However the doctor has ordered them, whether it be, 4 times a day, twice a day, once a day, bottom line is, they have to control their blood sugar. Because if they don't control their blood sugar, their coronary artery disease is going to get worse, that could cause them to have a stroke, and could then lead with deficits, or some stroke patients do die. Okay, your patient has an abdominal aortic aneurysm. Okay, abdominal aortic aneurysm, and the gold standard diagnostic test for that would be a CT with contrast. Because what's an aneurysm?
A weak vessel in the.
Yes, it's a weakness or bulging in the vessel of an artery.
Yeah.
In the wall of an artery, vessel of an artery, yeah, wall of an artery. So an abdominal aortic aneurysm, there's a weakness or bulging in that abdominal aorta. And if they do a CT scan with contrast, that would show them immediately what's going on there. Okay, so your patient is, you are working in the doctor's office and your patient comes in and his blood pressure is elevated. You look back in his chart and it's been normal up to this time. So, what do you do for this patient? Do you start teaching them right away about hypertension?
No.
They
drink,
like, things like coffee.
Ask if there's anything they did to increase their blood pressure before it began.
Yeah. Yeah, you can ask them if they did anything different, prior to this, but do they make a diagnosis of hypertension based on one
No.
reading?
No.
No. They're gonna have to, have them come back in a couple of weeks and they'll check it again and see, cause they don't make that diagnosis, until they have, 2 or more, blood pressure readings that are, elevated. Okay, your patient has an abdominal aortic aneurysm that's 5 centimeters.
They have a what?
An abdominal aortic aneurysm that's 5 centimeters. Okay? So what kind of teaching are we gonna be doing with them? At this point, dietary changes are probably a moot point, as far as this particular thing. If they've got an aneurysm at 5 centimeters or better, chances are that the instructions we're gonna be giving them are pre and post-op instructions.
Yeah, that's what I'm gonna say, for surgery.
Mm-hmm, yeah, we would be getting them ready for surgery, giving them pre and post-op surgery, because there's nothing really else they can do. There's not really any activities that they can do to keep it from rupturing. There's not really, dietary changes would be part of the post-op instructions, to prevent, further stuff from happening, but, you're not gonna change anything in their diet to make that aneurysm go away. Same way with, blood pressure. Afterwards, teach them, how to control their blood pressure, how to take the medicines, but at that point in time, okay, your patient, huh?
That cough.
Oh, that wasn't me.
No.
Okay, your patient has valvular disease. Which valve do you think it might be? What? Most commonly affected valve is a lot of people want to say mitral because that's what we hear about a lot, but actually most commonly affected valve is the aortic. okay? Probably the next one would be, the mitral valve. Okay, your patient, is teaching, all about his coronary artery disease. And so what kind of things do you need to teach them? Okay, so they're to dietary changes, so they wanna, increase their daily intake of saturated fat. You're gonna teach them about their, smoking, that they need to get into a smoking cessation, program, just so they can stop smoking, that they should be exercising. And what about nitroglycerin? What can you teach them about nitroglycerin?
Supposed to sting.
Okay, yeah, it should sting a little when you put it under your tongue. You should store it in that little brown bottle it comes in, away from heat and light. Okay, what else?
Take it every, if you have it at, every 5 minutes, if it's 3 times.
Yep.
If not, you
Take it once after 5 minutes. Doesn't work, call somebody, then take it again.
Right, and you can take it up to 3 times, 5 minutes apart each time.
until,
Okay, your patient has carotid artery disease, and what potential, health problems are they at risk for? And we already said this one. Stroke. What do your carotid arteries feed? Your brain. So if they're not working, you are at risk for a brain attack or stroke. Patient has a 7 centimeter abdominal aortic aneurysm.
They're going surgery.
Okay, so they're going to surgery. But in the meantime, while you're waiting for them to go to surgery, what should you do?
You're not moving.
Yeah, you wanna keep them on bed rest, keep the head of their bed flat, because you don't want anything that would put pressure. If you sit them up in bed, that's gonna put more pressure on their aneurysm. So you're gonna keep them laying flat to keep the pressure off of that aneurysm. Okay, so your patient, has atherosclerosis. And, what kind of symptoms might make you think that they have atherosclerosis?
High blood pressure? Symptoms.
Okay,
Would that be like, yeah?
actually, atherosclerosis, along with several other things, are often called the silent disease, because you don't really notice, or it's not diagnosed that you have it, or you don't notice that you have it until you start having symptoms. Okay, so yeah, high blood pressure would be a symptom that they already have atherosclerosis. Another thing that would be a symptom would be pain on walking. Anytime they increase the oxygen need to an area and the heart can't meet that need because the vessels are partially occluded, that's a problem. So, and we use our legs all the time. So if, you're walking and all of a sudden you got, cramp in your leg, you got pain in your leg, and it goes away after you sit down, then that could be your first sign that you have atherosclerosis. Okay, so your patient here we go. You think that they may have a clot in their femoral artery. What kind of symptoms might tell you that they have a clot in their femoral artery? Well, but they could have pulses coming through, their blood flow through other arteries.
Would be 4.
Swelling. Okay, so if there's a blood clot, say this is your femoral artery here. Okay, and let's say we have a blood clot right here, then we're gonna see some swelling of that thigh because the blood's not getting through there. Does that make sense? Okay, and it may be all the way, clear down to the knee. Let's see, your patient has, you're going over the anatomy and physiology of the heart. And you're talking about heart flow, the blood flow through the heart. And you need to know this, so let's go over it and remember it, okay? Blood comes up, inferior and superior vena cava, and goes into right atrium. And then what valve does it have to go through? Yeah, it goes through the tricuspid valve to get down to right ventricle. And then what valve does it go through to get out of the right ventricle? Pulmonic. And then it goes through what vessel after through the pulmonic valve?
Pulmonary veins, or no artery, sorry.
Pulmonary vein. That's the only place where blood going away from the heart is in a vein instead of an artery. Okay, that's the only place. So it goes through the pulmonary vein, through the lungs, then comes out the pulmonary artery to the left atria, and then it goes through what valve? Mitral or bicuspid, whichever you want to call it, that's right, to left ventricle, and then it goes through the aortic valve, to the aorta, and out to the body.
What's after the left ventricle? It's like 10 people saying it.
It leaves the left ventricle, it has to go through the aortic valve, and then through the aorta. Okay, so you'll know your valves, know your blood flow through your heart.
Goes in one end, not the other.
Yeah, it goes in one ear and comes out the other, that is true, but,
Not quite as specific as we.
okay. So, what is pericarditis?
Inflammation of the pericardium.
Yes, the inflammation of that tissue that surrounds the heart. Okay, yeah, the epicardium, yeah, okay, inflammation of the area that surrounds the heart. And your patient is being assessed for heart disease. So what kind of tests, if they're ordering, okay, they'll order a stress test, but when they're looking at lab tests, for which test in specific do they have to fast? Nothing to